We have a large dominant cyst, and I'm keeping my transducer a little bit right of the midline of the liver. So that will be in the right lobe of the liver. We have this dominant cyst. We can try to take a measure on it just to have an idea what size we are speaking about. And we are speaking about the size of 11-12 centimeter. We can see there is plenty of normal liver tissue in between, but there is some quite large dominant cysts and a number of smaller cysts as well. On the left lobe here, again keeping it so we're having the aorta in the lower part of the image. I can here try to add the color. And we can identify the aorta here in front of the spinal structure. Then we will move away from here. That is in the left liver lobe. We go to the right liver lobe and all the way upwards as far as the dissection allows us. And then we can see the cystic structures out here become more complex, whereas it is a little more simple cystic appearance here. You can see the cyst I have in the anterior part of the image now. Let us put an arrow on. Here we have the surface of the liver, and here we have very thin layer into a cyst. And from that cyst there's only a very small septa and another small septa to the borderline of the dominant cyst. So if we could break down this area here, then we will be directly taking the three largest cysts in the left liver lobe and the large in the right. That will definitely give us a good access. On the other hand, to the anterior, more lateral and anterior part of the liver, then you will have a certain amount of liver tissue, and that will not be a good window for it. And then there might be another window in the back of the right side laterally on the liver. I think we should do the contrast to evaluate whether the remaining liver tissue is as normal as it appears. So I think we will prepare the contrast. We inject the contrast, and in the same moment we start the injection, then we will also start a stop clock, which will start counting up. That will provide us an idea about which phase we are looking at, and also used for documentation afterwards. We will have the contrast image on the left side on the screen, corresponding to the guiding image in black and white ultrasound on the right side of the screen. Now we can see the contrast is appearing. The cyst will of course remain dark and without any flow, and now we can see the vascular structures, and that is why I also want to evaluate the structures of the septa. For instance, between here we have to face that there is actually a vascular structure between these two. On the other hand, between these two there is not a vascular structure. So it can provide us quite important information. Here we have the cyst as we planned actually to make the deroofing at, and here we can see that there is no vascular structures inside this area. There is maybe one here, which we also can see corresponding here. But in this area here we can make the roofing, and at here that will also be without any larger vessels. So I think actually it is a good way to demonstrate that we can do this in a safe way to fulfill our aim, deroofing and finding a way through 3 other cystic volumes until we reach the large dominant cyst in the right liver lobe. Let us go around and see on the smaller cysts, and if they should hide any solid structures in between in the liver. And there's a considerable amount of wealthy, normal looking tissue or liver parenchyma, which is good for the patient's prognosis. Directly from the central sterilization department we receive the small box here. That is containing the devices which we need for this steering. As we can see, there is 3 channels which we are going to select between for which angle we perform the puncture under. So this is the devices which we need, and then we will have to assemble it. By placing this locker system here, which has a small tab which is containing the movable part here in a position where we can utilize it. So now I just open it, place it